Okay, good afternoon, everyone. We will, conscious of time, so we will make a start. So as all of you have just sort of met myself and Alice, we're both physiotherapists working at the Queen Elizabeth Hospital in Birmingham. And we've been working probably for the last decade in liver disease, where we've initially kind of started with patients with that were undergoing a liver transplant. And this is now branched out into kind of all different types of liver disease, with Alice playing a key role in how we're managing fatigue in patients with autoimmune liver disease. So today we really just want to give you a bit of an overview of what is physiotherapy, maybe a little bit of myth busting along the way, trying to work out, why on earth are we standing here today, and how did we get here, and what are our expertise, and what we hope for patients with liver disease going forward.
So welcome to you all. Firstly, I'd just like to say that we have tried to incorporate some IT tech into this presentation. So hopefully, fingers crossed, it will work. So we want it to be as interactive as possible, because we, of course, want to hear a little bit about your voice. As Felicity has mentioned, really what we want to do to start with our sessions is get a better understanding of what a physiotherapist is, or even what a physiotherapist means to you if you've had interactions with physio, and then more specifically, the physiotherapist's role within liver care. So where do physiotherapists actually sit within the healthcare system? So a physiotherapist actually has to go off and complete a physiotherapy degree. So it's a protected title. So if you're potentially exploring the avenue of physiotherapy, or you're seeking out a physiotherapist, it's really important that they have the correct accreditation. So a physiotherapist by nature has to have a physiotherapy degree. You may have come across the word allied health professional. So we are classed as AHPs, and that's what that short term is for. We're not doctors, we're not nurses. And actually, in terms of AHPs, there's 22 different types of professionals that sit under that AHP bracket, all with their own individual degree. That's my little physiotherapist in the middle. Okay. Right then. So here is where we have potentially our first stumbling block, which is IT. Okay, so what we would really like to know from you is, what is a physiotherapist to you? What springs to mind? So for those that feel confident to do so, if you scan the QR code, what it will do is it will take you to a site where there's a code at the top. Enter that code, and then it'll give you 3 options to put just words, just a single word. And please be kind to us, we're up here. So just really to get your opinion of what you think a physiotherapist is, or if you've had any experience, what that has looked like.
Just to scan the QR code, if you put your camera on and hold it up to the screen across the, can they see that down there? The QR code, this black and white thing at the bottom here. It will give you a little website to go to.
So great, some things are coming through already, which is brilliant. You can put up to 3. Yeah, so 1 word at a time. You can put 3 answers. Just 1 word. Yeah, what springs to mind?
It's not a test.
Not a test. No right or wrong answers. It does. Yeah, absolutely.
Okay.
So really just to start thinking about some of the answers that have come in up here, certainly I can resonate with a lot of those words. So it's about getting people moving. Perhaps if somebody's had an injury, it's about restoring function, restoring movement, helping with recovery, often focused on perhaps muscles, maybe using exercise or rehabilitation as a way of doing that. So those are really excellent suggestions. Great. Nice to see exercise in there. We love that. Yeah, great. And I actually think a lot of those things that you've mentioned as a group there are all things that as physios we certainly can resonate. It's good to think that our perception of what physiotherapy can offer is also perhaps some of the ideas that you have within the room. Just move on from that here. But ultimately, some of the key themes that the Chartered Society of Physiotherapy recognise physiotherapy to be. So this is a separate chartered body. It endorses the physiotherapy degree, it endorses our HCPC registrations. That's our ability to actually be a physiotherapist. It's all about restoring function, restoring movement, but really importantly, also restoring confidence and then allowing empowerment to those patients or to individuals so that they can achieve the goals or whatever they want to do in terms of restoring health. So again, core components of physiotherapy. If you ask a lot of the general public, there is a perception that perhaps a physiotherapist works predominantly with what we call musculoskeletal injury. So that might perhaps be a broken ankle, a damaged shoulder. I'm sure we've all witnessed, you know, Andy Murray going over on the tennis court and footballer going on and the medical, the physiotherapist running on to try and support that acute injury. But that is actually just one of the 3 pillars based on physiotherapy. So we also have a lot of involvement in terms of cardiorespiratory health, so that's heart and lung health, and also those neurological conditions. So perhaps things such as stroke, MS, Parkinson's, and again, it's all about those 3 core components. So restoring movement, restoring function, and restoring confidence. But I think what's really important is that despite those 3 pillars, they are all very much intertwined. And just because you might present with, say, for example, an ankle injury, it doesn't necessarily mean that you might not also have a neurological condition, or you might not also have a respiratory condition. So they are very much intertwined, which is why as physios, we need to have a good understanding of the breadth of what patients potentially could present with.
Thank you, Alice. So I'm just going to move this chair because I feel like Alice and I are going to fall off the end here. There we go. So we're just going to talk you through now what we think about when we're seeing a patient and completing our assessments, and then how we think about what treatments are on offer for patients going forward. So in terms of the assessment, whilst we think about movement and exercise and things like that when we think of physiotherapists, when we actually assess the patient, we normally look at kind of the physical, the psychosocial components of the assessment, and then link that back in with the medical context. So as physiotherapists, we tend to learn quite a lot about medical conditions, not in the same depth as medics, but we will have a good understanding of them so that we can understand how our assessments and our treatments are impacting within the context of that condition. So if we just move on to the next slide, thank you. So when we think about that then within the context of liver disease, we might be assessing things like physical frailty, and we might do that by looking at different types of walking tests, how to do like different chair stands, how long it takes to stand up and down from a chair in a certain time. We might look at muscle strength, joint range of movement. We might look at sort of neural kind of tests as well. And we'll be thinking about how much of there's a risk assessment associated with that as well. So not just kind of what you can or can't do or how much movement there is, but what impact that is having around sort of risk of your everyday life, or what we're going to think about in terms of treatment. We're also going to be looking at in the middle there like a fatigue assessment. And then we're trying to apply that to then prehabilitation or rehabilitation principles. So rehabilitation is normally recovering from something. So that might be from surgery. It might be from a bout of illness. It might be because you've torn your ACL ligament and you're rehabbing from that. And prehabilitation is that you are preparing for something. So somebody, for example, if they're going for surgery. So there's a lot of around prehabilitation around cancer surgery. We're now looking at it with liver transplant as well. But there's also a lot around prehabilitation for patients who go for knee operations, hip operations, and things like that. So we kind of work around events, medical events that happen, as well as kind of looking at chronic conditions and how we're managing patients with that. When we're looking at that, we're looking at it from the kind of psychosocial element as well. So we're looking at kind of behavior change, if that's required, or how behavior is impacting on the patient's ability to do something or not, what barriers or challenges there are in the patient's life, what's their kind of setup at home, what kind of support networks do they have, what kind of responsibilities that might be from, you know, having children or work commitments or caring responsibilities. And we kind of group all that together to provide a treatment program that is going to be personalized and beneficial for the patient. So in terms of them, we talked about exercise and physical fitness really for patients. And when we look at that, we think of physical fitness as one single kind of continuum. And at the kind of middle part here, we have Joe Blogs, okay? That's someone with kind of very average level physical fitness, probably something that we'd all strive to have. It means that we are moving in a way that is healthy, okay? And if you think about kind of preparation for sport or elite athletes, you'll see along this continuum, you get lots of, you know, we just had the Olympics on and the Paralympics has all been really, really exciting. And there would have been a huge team around these Olympic athletes, ensuring that they are not just Joe Blogs, but they are right up at that elite level physical performance in order to do what they're able to do. And some people kind of sit somewhere in the middle there where they're kind of quite a fit person. They may be running marathons or, you know, like playing tennis several times a week or part of a football team or whatever it is, but they're there. And then at the other end of the spectrum, we have what we would say is sort of almost, you know, no physical fitness whatsoever. So a patient who may be on critical care, who's completely ventilator dependent, their heart and lungs are needing support in order to be able to work. And what we find with patients with chronic conditions is that they tend to start leapfrogging down this end of the continuum. So people, whether that be because, you know, they don't have the confidence to be physically active, whether they feel really fatigued, whether they've got other injuries going on, whatever the reason, they might have flare-ups or acute illnesses, they might need to go in for surgery, and they start leapfrogging down this continuum. And it's our responsibility as physiotherapists really is to work on this end, where we try and get the patient back towards being that healthy, call it Joe Blogs, but that kind of healthy level of physical activity that we need. And so that's really where physios kind of sit. So we invest quite a lot of knowledge in exercise principles that you see actually in the sporting world, but it's just done on a lot lower level, but they're very similar principles. So I'm just going to kind of relate this back to that continuum a little bit more and think about you as a patient, okay? And actually, it's not too dissimilar to preparing these athletes for the Olympics, okay? Everyone has their kind of gold medal moment or their goal that they're trying to achieve. And for these two amazing ladies, obviously for them, it's to stand on the podium at a major event, whether that be the world title, the Olympics, that is where they want to be. But it doesn't mean that through that 4-year Olympic cycle, that everything is hunky-dory. They go through peaks and troughs all the time with their training. They come across things like injury, illness, bereavement, starting a family. Major events can get cancelled. And they deal with all these kind of spanners that come up them during that time. And the reason they get to that kind of gold medal moment is because they have this huge team around them that's working with them all the time. So they have physios, nutritionists, strength and conditioning coaches, their sponsors enable them to do what they're doing. They have behavioral psychologists, technical coaches, in order to make sure that during these peaks and troughs, that they still maintain their optimum level of physical training, and then they can try and get to that gold medal moment. And for me, this is the same for a patient, okay? Everyone has their own things that they want to be able to achieve, and everyone wants to be able to live as healthy a life as they possibly can. And you as a patient also have a huge support network in terms of you will be under the physician, GP, your support network at home, pharmacist, specialist nurse, dietitian, and we hope more physios in the future to work with that. And I'll tell you more about that.
So how does that bring us to PBC then? So we've thought a lot about what actually maybe a physiotherapist is, or what your opinions on perhaps what a physiotherapist can offer. We've also then talked about how specifically mine and Felicity's role is embedded within liver disease. But really what people, I'm assuming, want to know in the room is how is that important to PBC, and how do we improve your situation at the moment? And I think from the Q&A and the talks you've had this morning, I think a common theme is that individualized approach, that holistic approach, and possibly that opportunity for conversation, having that opportunity to be able to speak to a clinician or speak to somebody where you can be truly raw and honest about how you're feeling. Now, certainly as my role has progressed, I have sort of tried to ensure that the first part of my assessment is very much rapport building. If you are faced with a 10-minute consultation with an individual, it can be really quite challenging to unpick specifically what the needs of that individual are. But actually taking the time to really listen to our patients, to really understand what is troubling them, what their burdens are, what their symptoms are, and what their goals are, will allow us to be extremely patient focused. So how are we going to do that? Well, we have talked a lot about exercise, and we still very much are in the early stages of what type and how much exercise is beneficial to our patients. But one thing we have noticed from the small studies that we have done is that exercise can have a positive impact on our patients, whether that be from symptom burden or management, such as fatigue, possible joint pain, mood, help with sleep. So if there is the option in your specialist centres to access physiotherapists that have a specialist interest within liver, I certainly recommend that conversation, or even speaking to your consultant or clinician that you visit, even if that's yearly, just to see what services are available. And really, what we're hoping to do is tap into your overall health and well-being. If we're able to address some of the symptoms that are really causing that burden, overall, we would like to think together we can improve your quality of life. And again, echoing the holistic care approach, it's not just going to be physiotherapy that improves the situation. It's that full multidisciplinary or athletic team behind an individual that's really going to support them. And that doesn't necessarily have to be from only a clinical space. That could be from loved ones, friends, family, your support network, and it's everything together that is going to help manage your situation. And then 3 of the common things that we come across as physiotherapists are pacing yourselves. You've all got extremely busy lives. Okay. And that can be really challenging with a chronic condition. And I certainly don't know if people in the room ever are faced with, well, I don't look ill, so people don't understand. Or I'm at work and I might pass a comment of I'm feeling tired, and your colleague goes, yeah, me too. I know what you feel like. And actually, no, they truly don't. But because you don't appear to look unwell, or you try and explain how you feel, and obviously, mostly it's through trying to relate to someone, but someone comes back at you with a me too, it can feel a little bit disempowering, because actually, no, they probably don't know exactly how you feel because they don't have this chronic condition. And when we're faced with very hectic schedules or life commitments, including young families or grandchildren, or just, social life, energy expenditure can be really challenging to know how to invest your time and what potentially could be the consequence if you overinvest. And that links in nicely with fatigue and then how well we're sleeping. 2 things we're going to touch upon over the next day or so in terms of what we think we can do to improve it. So how do we get your gold medal moments? This is all around, the athletes, they get their gold medal moment. How does it feel as a clinician? How do we get that gold medal moment? Well, I can tell you, this is how we get our patient success. And it's by being holistic. It's by being patient-centered. Now, this individual per se actually ended up having transplantation. And again, we don't want to feel fear in the room. It's unlikely, given the nature of your rare disease, if it's well controlled with medication, that you won't progress to this side of the scale. But it just shows that going from that continuum of a ventilator all the way working through with the MDT and physiotherapy specific, we can get patients up and back to where they want to be. So just some comments that she mentioned: before transplant, I could only walk a few meters with crutches. That's that sort of prehabilitation. 3 months post-transplant, I put on my running shoes and headed out. There were lots of tears for my donor. Thanks for everyone who supported me along the way. So that recognition. And the last one I really love: I run I am a runner. So it's thinking, what motivates you? What is your goal? What do you want to work towards and feel empowered by that?
So just in summary there, it's to really kind of highlight, I guess, that physiotherapy is very broad. It's almost like medicine in terms of that physiotherapy can appear in lots of different aspects of the healthcare system. And it's one of a huge multidisciplinary team that can be available to support patients. We believe there's a really big scope for physiotherapy within liver disease and particularly with PBC. So we're really excited to be working on some studies that we'll tell you more about tomorrow in terms of like how we can improve symptom burden for patients going forward. We just really wanted to emphasize that we're all about kind of personalization and patient-centered goals, and that is kind of our remit. And so we're really excited to be here today, and we really want to thank the PBC Foundation for having us, because getting to meet you and to having these, we hope to have some more interactive sessions as we go through the course of the weekend. And we'd really like to hear your thoughts on where you would like physiotherapy to go and how we can best support you so that we can make sure that it is personalised and holistic and addressing all of the needs that come with living with PBC. And thank you for coming today.
Delighted to have you here. We do have a couple of questions. One of them I think actually relates to conversations from earlier. Can you elaborate on brain fog and complaints you may hear? I have become forgetful and frequently lose things, but it's hard to determine if it's just the aging process or PBC related.
I think that's a really great question, and it can be challenging. And I think we're very good at putting things in categories and saying, well, because of this, it must be this. So I'm getting older, so I'm becoming more forgetful. But I think truly it's about recognition within yourself and noticing how quick has that change been and what has precipitated that change. So in terms of brain fog, it is that sudden power down. So almost like a battery, you know, you're okay. And then suddenly there's that power down. You really feel you have to stop with what you're doing. That is sort of that true brain fog classification. And how frequently is that now happening? And what are you doing at the time when it is happening? So in terms of splitting the two, I think it's about asking yourself, what were the symptoms? How frequent are they? And are they getting worse? And if it's quite a new thing, I would say it's probably more towards the PBC fatigue side. And if it's been gradual, it could potentially be associated with aging, but either or, it could be that you perceive it to be one and it's the other. So it's about how do we recognize that symptom? And ultimately, we still need to manage it. So whichever it is, there are still strategies that can be done to manage that symptom.
Thank you. I'm currently recovering from a viral illness and my voice became hoarse and weak for the past 10 weeks. ENT described it as post-viral fatigue. Am I more likely to get this kind of reactions to viruses due to PBC?
And that's a really tricky question, certainly for myself. The answer truly is I couldn't answer honestly. I don't know the answer to that. And I think sometimes when we feel we're susceptible to something, we expect it every single time, and that's not always the case. It could just be completely unassociated. It could be an extremely unfortunate byproduct of this particular virus. So unfortunately, I couldn't hand on heart honestly answer that question. Unless you've got
No, I just you don't know whether it's an isolated case or whether it could continue again, but it's worth talking through with a physician next time.
Is there a way to physically distinguish between RA and osteoarthritis that a patient can recognise?
There is, but I don't.
Only from observation. Is just generally certainly further down the line, apart from blood testing, which can be challenging, you know, if you're unaware of how to recognize a symptom. And the inflammatory markers associated with RA are much more profound on blood work than they are you know, compared to osteoarthritis. The most common giveaways with RA tend to be peripheral. So that means like sort of feet and hands, and you get very noticeable sort of deformity of the small joints, particularly the fingers and toes, compared to osteoarthritis, which predominantly, but not exclusively, affects the larger joints, such as hips, knees, shoulders, and elbows, wrists. So from a patient perspective, if you're concerned, I would say early seeking out of support, GP review, that's what also they are there for. So don't sit in silence. If you're concerned, listen to yourself and go and find out. You don't have to have the answers as the patient. That's what the MDT are for, but they're sort of the common things that we notice as clinicians.
How do I find a physiotherapist who understands about MSK issues and liver disease?
Can you let us know when you find them?
When you find them and send them to us. I don't, you're very unlikely to find someone. Physiotherapy is very new to liver disease. It's not something, even liver disease is not taught at undergraduate level, and it's not really recognised within physiotherapy that there's a role for physio within liver. Hand on heart, I think I'm probably the first, maybe Kate, two of us are the first physios that specialised in liver disease, and we started doing that about 10 years ago. Now within our bowel community, we probably have somewhere between a dozen and 15 physios across the UK. So somewhat, we all have had training in MSK. Some of us had more experience than others. So sometimes you can kind of go from that. I guess with any physiotherapy issue, we're always looking at the primary problem, and we will aim to treat that first. So if you have an isolated musculoskeletal injury, then you should very much see an MSK patient and a physiotherapist, and talking about, information leaflets that you can give to your GP about PBC, you should also provide to your physiotherapist so that they can have a look at them as well and help them. You're going to need to help educate them. So don't be afraid to say, this is what I've got and this is how it impacts me. And, you please consider this when you're treating this condition. And if you actually provide them with information, physios are genuinely quite motivated people, where my uncle's a radiographer and he always used to joke that the rest of the MDT kind of get in the lift at the hospital and the physios are always running up and down the stairs. So that's the kind of our vibe in life. And we like to learn. So I'm sure most MSK physios, if you provided them with information about your condition, then they would be very keen to kind of have a read up at that and see how it would impact in what they're doing.
Or even reach out. Certainly as a physio, if there was something I wasn't familiar with, I wouldn't be afraid to reach out to a physio that perhaps is in that specific area. So don't underestimate, I would say, the power of network.
Just where we are running into break now, so we are going to start getting people back. It could start to get noisy here. So perhaps if we go for one more question, and thank you to everyone that submitted their questions. As before, we'll try and get to them during the course of the conference. If not, we'll certainly keep them and we'll incorporate them into our weekly FAQ. So thank you so much for taking the time to submit them. So final question for now. I exercise now more than ever in the last 5 years. Movement is medicine. However, the fatigue from this is hard to juggle. Any tips?
Firstly, it's brilliant to hear that that person feels confident and strong enough to go out and move their body in a way that they feel comfortable to do. Like with sort of what we mentioned as part of the Q&A, it's finding the balance of how much is the right amount for an individual, particularly if previously you're used to a certain level of intensity or a certain level of exercise, and it's knowing what other precipitating factors can contribute to fatigue. It's not just activity that causes fatigue, and I think that's really important to understand. It's possibly how well you're sleeping, how your potential mood, the burden of any other sort of lifestyle related activity, whether that be work, whether that be family. So my biggest piece of advice, in the absence of knowing truly what that prescription of exercise is around pacing and just ensuring that moderate rest is incorporated into that sort of weekly routine. Sometimes, and I hate to say it as a physio, but sometimes when you've got profound symptoms like that, less is actually more. Easing off the tank a little bit. Don't allow that battery to run all the way to flat when you're exercising, particularly if you're having the symptom of fatigue, is probably going to hold you in good stead in terms of recovery. But in the absence of truly knowing, which is why we're doing this research, it's quite hard to give a specific answer, but they would be my first line pieces of advice.
I would say, listen to your body. You know your body better than anyone else. And if your body is telling you that you are that fatigued, then it's telling you slow down, a little bit. That's not to say, you know, people live with fatigue and probably become inactive. So it's not saying stop, but it's just made, as Alice said, just, you know, tail back a little bit. Sometimes we can be so focused on kind of tackling something and not tuning in. So it's about the recognition is just as important as the doing.
Thank you. Thank you once again, Alice and Felicity.
Thanks very much.
you.
Thank you.